So the first guy I alluded to earlier is a soccer player. He'd go forward on a bicycle this way, but he could not go side to side. The meniscus in both knees were shredded, let's just say. And we injected him with some really powerful stem cells. In about 3 weeks, he called me. He was ecstatically joyful. He was playing soccer again. I told him not to, but he felt so great. And I know patients also where we have MRIs showing before and after with stem cell injections, and the meniscus did grow. It's a very thin layer, but it did grow back. All right, let me tell you a story about a patient that came to me about 3-4 years ago. He was in his 30s, and he had a meniscal tear. It was pretty bad. He could go forward cycling, but as soon as he went side to side, like a skiing mobility movement or playing soccer on a field or any kind of sport like that, incredible pain, he would almost fall down. So he came to me, he said, how can you help me? I said, well, probably with the MRI and how old you are and everything, it should probably be stem cell injection. So we actually did it. And at that point in time, we were using a company, I forget the name, but they had really, really powerful stem cells. And actually, I mean, the words speak for themselves. I got 2 Yelp reviews on 2 different practices, my Arcadia and my Fullerton practice, really amazing reviews from him. And I still see him like once every maybe 2 years or so, but he's still doing strong. So we have many, many different treatments for knee injuries or knee pain. I'd like to say a few words about the surgery for knee pain, the meniscal tears. Well, first of all, the meniscus is a shock absorber. It goes between 2 bones. It's a very, very powerful shock absorber. As we get older, it starts to deteriorate, and inflammation and a lot of other things makes it can actually disappear when you get, probably at 67 years old. And the industry now with this kind of surgery is a $4 billion a year industry, over 700,000 meniscal surgeries a year. There's a video that I've seen, and I've done some research on this, that basically says that meniscal tear surgery is just about as good as physical therapy. And that many times when they do that, when you take out part of the meniscus or you trim it, you actually increase the stress and wear and tear on the knee, sometimes like 60 to 70% more just by taking out 10% of the meniscus. So if many of these surgeries are taking out a large part of the meniscus, you're increasing the stress on the knee an incredible amount. And not to mention, a lot of people are overweight. So if you're overweight and you have a knee injury, obviously, and everybody knows, and you want to lose weight, that's one of the things I'm definitely going to help you with, because we have a really strong weight loss program. So there's 3 different levels if you're just talking about treating the knee. So I wouldn't just treat the knee. I would look at labs. I would look at systemic labs. I would look at everything, your hormones, because a lot of hormones have to do with replacement or rebuilding of tendons, ligaments, cartilage, muscle. If you don't have enough testosterone, you can't do these things very well. That's probably why you're in the situation you're in now. So I want to optimize your body, systemic, and I also want to treat, local at the knee. And so we have a machine called a shockwave machine. Some people call it a stem wave machine. It comes from Germany. That's the best one that I could find. It has acoustic waves that actually it's almost like ultrasound that we do in a machine. It's like kind of like a gun. We put it on your knee, and then it goes chung 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 chung. It makes a noise. Sorry, I can't reproduce the noise very well. And it actually goes into the knee and starts to change and rebuild the cartilage. Helps bring many, many stem cells to the area. It's been used in Germany for a long time. Here, it's just catching on now. So those treatments, I've seen them work without anything else, so that we could just do that. The second line of defense is ozone. And naturopaths have a lot of ozone therapy in their practice. We do ozone IVs, rectal ozone, vaginal ozone, ear ozone. It's amazing for decreasing inflammation and killing bacteria, virus, fungus. And it also helps to decrease autoimmunity a lot. So those are the 3 basic things that are the worst problems in our bodies right now. So by doing some ozone IVs, also we can take ozone and inject it right into the knee. So typically, on the first line of defense, if you can do it, depends how far gone your knee is, how much meniscus you have left, how old you are, how obese you are, how toxic you are. We can start with PRP and ozone. This is the cheapest way to do it. Do some shockwave treatments. You need a package of 3 to 5. Do one-time ozone and PRP. I'll probably inject on 2 sides, maybe 3 or 4 different places on the knee, depending on what the MRI says. And usually most people can have some really amazing benefits from that. The second line of defense would be using peptides, systemic peptides, and inject it to the knee using ozone, possibly PRP, but also we could use what's called exosomes. Exosomes is what the stem cells make. We have some different levels of exosomes too. Then the third, or the top of the whole scenario, the treatment basically is using stem cells or Wharton's jelly. And I would probably use Cresca or one other company, VD, depend on the lab. But we've tested these labs out. And that's not a simple thing either, to find a lab that has good stem cells and good exosomes, because it's a massive industry. There's a lot of people, they don't really care so much what's in the product. They just want to make money, unfortunately. So we got to really cut through that. We got to know who the owners of the companies are. We need to see the results from other doctors. I really follow up on this, because I don't want to charge you guys the money that it takes to do a stem cell injection and hopefully fix your knee, and then you have no results. Because I will do it again. I'll give you another vial, and I got to make sure it works.
And now, a word from our sponsor. Today, let's uncover the secret to fuller, healthier hair with Folliton Hair Regrowth Serum from Entera Skincare. Imagine a serum that not only promotes hair growth, but does so using the power of peptides. That is Folliton, a scientifically advanced hair regrowth serum packed with potent peptides. They penetrate deep into the scalp, targeting the very root of hair loss. But Folliton isn't just about regrowth. It's about healthy hair. It is free from harmful chemicals. It nourishes your scalp, leaving your hair not only fuller, but also visibly healthier and more vibrant. So whether you're dealing with thinning hair or you're just looking to boost your hair's volume, Folliton has been a game changer for many. Head over to enteraskincare.com/Dan to discover more. Use promo code DAN for 10% off your first order. Folliton Hair Regrowth Serum by Entera Skincare. Unleash the power of peptides for your hair.
Okay, so I want to talk about two patients I've had who has this amazing, I would say, miracle results from stem cell injections in joints, knee joints. So the first guy I alluded to earlier is a soccer player. He'd go forward on a bicycle this way, but he could not go side to side. The meniscus in both knees were shredded, let's just say. And we injected him with some really powerful stem cells. In about 3 weeks, he called me. He was ecstatically joyful. He was playing soccer again. I told him not to, but he felt so great. And then to this day, he's still having the resolution on both knees. The other one was a woman who owned a medical practice. She wasn't a practitioner, but she was the owner of a medical practice in Orange County. And I think it was the first time I ever injected a knee. It was the doctor was there. He's like helping me. He was kind of watching. It was her doctor worked in her office. It was interesting. So I injected both the knees. And then, I'm not kidding you, within like 30 minutes, she went back to her office or somewhere in the clinic. She had her things there because she's the owner. And she put on high heels and came out. And she goes, this is the first time I wore high heels in 20 years. I've had such serious pain in my knees, I would never dare to wear. And that was just a miracle. It was in 30 minutes, almost pain was all gone. I'm not going to say every patient's like that, but many patients can have incredible benefits from using the regenerative medicine, regenerative injections. And we can do a combination of any of those three systems I talked about. Then we want to also decrease inflammation in the body, so we can give supplements for that. We want to also make sure your hormones are balanced. So it's like I can be a one-stop shop for a lot of different things. But if we're not well-rounded in our protocols and we're not looking at every possible system that can have a problem, a lot of times you'll get results, but you get a result for a month or two. You want your doctor to fix it for a while. I mean, you're expecting a year or 2 years at least. And I don't know, I can't say for life, but definitely we can get some really good results here. Okay, so let me explain a little bit what happens when the surgery isn't successful or goes wrong. I actually had an open house yesterday and I talked to a patient for about a half hour. It's just one in many, many patients. Yeah, he was overweight, but a lot of people are. So we need to get the weight off. He had a meniscal surgery about 6 months ago. He had a huge brace on his leg. So I was like, right away, what's going on? He said they took out more than they wanted to. They said it would get better. He said, basically, the pain is worse than it's ever been. He's lost range of motion. He favors it. I watch him stand up. He's having a hard time standing. It takes a while to get the blood circulating. And this, I don't know the cost of a meniscal surgery, and I believe probably insurance covers it. But what's going to happen is if he keeps going down the wrong path and he maybe gets cortisone injections, maybe someone does PRP, it's not really successful, he doesn't have a well-rounded protocol, he's actually going to need a knee replacement. Then after the knee replacement, you need a whole year rehab. So if you're using your knee for making money, let's just say, or just getting to work every day, you're going to have a really hard time. And are you still going to be able to work the job? Or are you going to be able to hold your grandkids? Are you, all these different things before you rush into surgery. Because many times I've heard this over and over again, and I'm not saying anything is wrong, or I don't know the circumstances, but every single time someone comes in, the doctor says, oh, I looked at your MRI and you have no more meniscus left. I mean, can you see that on an MRI? Do they really know there's like no more meniscus there? I don't know. But I know people have said that, and we've actually treated them and they've gotten rid of the pain. And I know patients also where we have MRIs showing before and after with stem cell injections, and the meniscus did grow. It's a very thin layer, but it did grow back. So, there's a lot of alternatives to the hardcore kind of the conventional medicine out there.